The world on the internet, I say good morning to both of you.
Good. How has the week been for you so far?
Been going absolutely wonderful, and just want to always a pleasure to join you on the air again.
Well, thank you so much. And the weather's
And
quite pleasant outside this morning.
all right, for those of you who are joining us locally as well as internationally, um, don't forget to tell your friends that every week, every Wednesday, 9:30 to 10, we do the program with some type of preventive healthcare topic. And for those of you who are local, you can go on the internet and watch this live at go to my website, which is AskDrFerguson, AskDrFerguson.com. On the center of the web page, you'll see a link that says Connect to Live Radio. If you click on that link, that will take you to a YouTube site, at which time there'll be a little house in the top left-hand corner. Click on the house, and then click on the word feed, and you'll be able to catch the program live. There's about a 30-second delay, so if you do decide to watch it live, you might want to turn your radio off because it'll be conflicting.
Right. So what are we going to talk about today?
Well, we've been talking about vitamins and minerals for several weeks now, and I've been trying to complete that topic.
Okay.
But I haven't seemed to get it all the way completed, so we'll talk a little more about that today. We've talked about some of the specifics on what vitamins and minerals do certain things for us, and why they're important, and why they're important for everybody to take. So we've talked about some generalities. We've talked about the B's, the C's, the A's, the E's, the D's. So just in brief summary, we'll do that again. You have water-soluble vitamins, which are your B's and your C's. And it's just as it implies. So it says water-soluble means it will be dissolved in water. And then you have fat-soluble vitamins, which will be your A, D, E, and K. Now, there are other vitamins, but these are the big ones we talk about. And those would need, by definition, fat-soluble, so they dissolve in fat. When you talk about vitamins and minerals, the vitamins, the B vitamins, you usually won't become toxic on those because they're going to be put out in your urine because they dissolve in water. Where your fat-soluble vitamins, if you took an abundance of excess, you could become toxic on those because they can build up in your fat cells, and they can build up in your liver as well. So as they build up, that might lead to some toxic side effects.
Okay.
So you do have to be a little cautious with your A, E, D, and K. And a lot of times if you're going to do a lot of A, it's best to do that as beta-carotene as opposed to vitamin A, because your body can utilize that better and can take the amount it needs and put the rest out. So it's important in all that to get an understanding, and that's the goal behind our program weekly, is to give you some information that you can live with and you can begin to implement immediately as far as preventive health is concerned. So it's very important that you build a fund of knowledge about some of these things, and don't just run off and take a million of one different things. And you heard this on Dr. Oz, you heard this on the doctor program, and you could end up taking a whole bunch of different things. But it's important to gain an understanding of what you're taking and why you're taking it. So vitamins and minerals, very, very important part of our daily life, and they do a lot of different things in our body. And they help with chemical reactions. They help with like a catalyst. A catalyst speeds up a reaction. So a lot of times vitamins and minerals, they do those types of things in our body. They help with metabolism in our body. They help our body function normally. So lots of different things that vitamins and minerals do in our body. There's lots of different types of vitamins and minerals that we have in our body. When you talk about, again, we're just in a summary mode here, but when you talk about vitamins and minerals, you have the word organic and inorganic has to come into the picture. Now, when you say inorganic, or should I say non-organic, which would probably be the better term, minerals are non-organic compounds. They're substance, they help in the body structure, they help build our body. We take them into our body, but they never change forms. They never break down. The same way they come into your body is the same way they'll leave your body. So no new minerals are being formed. The ones we had from the beginning are the ones we still have. And the most common minerals that people will know about are sodium and chloride. You know, every cell in your body has sodium and chloride, and some people refer to that as salt. So you have potassium, magnesium, phosphorus, sulfur. Those are other minerals, and we can refer to those as macro minerals. And then you have micro minerals. Those would be the smaller ones, micro being small, macro being big. And that would be things like chromium, great for helping control your blood sugars, cobalt, copper, zinc, selenium. Those are a few examples of your micro minerals. And again, they don't decompose, they don't burn up, they stay in the same way you took them in. That's the way they're going to always be, the way in which you took them into your body. As opposed to when you talk about vitamins, vitamins are referred to as organic compounds. So when we say the word organic, we usually thinking like something is living and something is more natural, something is in that category. So vitamins are organic compounds, and they're needed for many aspects of our body, for growth, maintaining health, catalysts, enzymatic reactions, lots of different functions they have in our body as well. So vitamins and minerals are very important for us. We get them from our fruits, vegetables. You get some from your meats. They come from the meats because the animals eat the vegetables and the fruit. But for the most part, we get most of our vitamins and minerals from vegetables and fruits. And even if your diet is the most wonderful diet in the world, you probably still have some deficiencies in some of the vitamins and the minerals. So this is where supplementation comes in, and all supplements are not the same. It's much more, it costs more to make a vitamin or mineral that has a coating that's very loose on it that dissolves very easily. So those usually cost more. A coating that's really tight and does not dissolve so easy, those usually cost less.
Oh, okay.
So you have to be cautious when you go in the drugstore or whatever you're going to buy your vitamins and minerals from, and you see two different products, products on the shelf, and one says vitamin E and it's $3.99, and one says vitamin E and it's $18.99. Well, a lot of your vitamins and minerals have a synthetic form and have a natural form. And whereas vitamin E, it has a synthetic form and it has more of a natural form. And the natural form is probably about 75% more potent than the synthetic form. So if you buy that one that you saw that was a lesser price, then you're probably getting a lesser product. As well as the way it's bound is very important, and people don't pay that part much of attention. But when you're evaluating a product, you want to be able to, you wanted to get it. A lot of times when I start a patient on a medication, and potassium is one of those big ones, that oftentimes I'll have my seniors on a potassium and they'll find it in their stool. So it never got dissolved at all. Calcium, another one of those big ones. Sometimes that can be found in the stool and never dissolved at all. And so a lot of people do calcium, and a lot of people will take calcium supplements. And just as a quick side note there, when you're going to do a calcium supplement, then you have to, you don't want to do calcium carbonate. Calcium carbonate is the most common form of calcium that you'll find on the market. It's probably going to be your least expensive, but it's also going to be your least effective. About 20% of people over the age of 50 will not absorb calcium carbonate. And so that's an issue. And the acidity in your stomach, calcium, if you're taking a proton pump inhibitor or H2 blocker or one of those things, they increase or decrease the acidity of your stomach. So they raise the pH. And when they raise the pH, that can also make it more difficult for you to absorb the calcium that you're trying to take in. So, your body is wonderfully made, and everything has to work in sequence with the other thing. So you want to be cautious, those of you who are taking things like proton pump inhibitors, antacids, H2 blockers, that be taking things like that to help with gastroesophageal reflux disease, indigestion, things like that. You want to take those away from the time that you're taking your vitamins and minerals, because some of your vitamins and minerals are going to absorb best in an acidic environment. When you eat food, or your body produces an acid to help you break down the food, and that decreases the pH in your stomach, which is the more ideal environment for some of your vitamins and minerals to be absorbed. Where when you take the medicine to help decrease the indigestion and things like that, that increases the pH in your stomach, which is less acid. Consequently, you may not absorb some of your vitamins and minerals as well. So that's a little side note, a little tidbit there, just to help you, some of you out there.
Okay.
Again, for those of you who are listening to us local, you can always join us on the internet. And you go by my website, AskDrFerguson.com. Click on the little live radio. Then you go to YouTube, click on the little house, and then click on feed. And you'll be able to catch us. You'll be able to watch us live. You also can always call my office at 252-332-6484. We're always happy to see new patients. We have a family practice, a general practice. We do a lot with Alzheimer's disease, a lot with natural hormone therapy. We have a substance abuse clinic, and we have some other things we really enjoy doing, things like that, weight loss, weight management. So by all means, we're always happy to see new patients, and we welcome those of you who would like to see us to come by and see us, or if you want us to talk about a certain topic online, on the program here, then let us know. Call us, the radio station, or come by the office, or call the office, and we'll be happy to try to discuss that topic for you. So that's kind of the way that goes. Now, let's get a little back more to more specifics about the vitamins and minerals. Now, we started going down a list of some more specific things that some of the vitamins and minerals do, and I don't remember just how far we got, but maybe we'll start with vitamin C.
Okay, now we didn't get to the, all right.
How far did we get? Do you remember?
Yeah, we're talking about the vitamin and the organic compound. I think that's what we got.
Well, I mean from the previous programs. All that I just did just now was pretty much just a summary.
I really don't know, because last week I think I was busy with you.
Okay. All right. So that was just a summary of some things we've talked about in the past. So we'll start from where I think I was last week.
Okay.
And I think we were up to vitamin C. And we were talking about the different individual vitamins, some of the things they do, some of the benefits they have for us, maybe some of the amounts I suggest you take. The vitamin C is one of your most powerful antioxidants. The antioxidant is a compound that helps get rid of a free radical. So what is antioxidant? What's a free radical? Real brief. A free radical is one of your cells that begins to function abnormally, and it loses an electron.
Mm-hmm.
And that's kind of like it's coding. It's probably like it's outside the electric force. And it loses part of its electric force, and the antioxidant comes in and it gives that electric force back to that cell so it can function normally. And when you talk about free radicals, that's going to be the trigger for many of your cancers. It's going to be the trigger for cells going abnormal, doing things abnormal, things like that. So the antioxidants help stabilize your body in helping to stabilize those free radicals. And there's many vitamins and minerals that can work as antioxidants, but ascorbic acid, which is vitamin C, is one of your more powerful ones. And it's been suggested that Linus Pauling, who's the guy that invented the alpha helix, which is the backbone structure of our DNA, not invented it, but discovered it, that he did anywhere between 5 grams to 10 grams of vitamin C a day, and it suggested that he lived to be a ripe old age and was never sick. So I don't know the accuracy of that, but I do know that vitamin C is a very good thing for us to take on a daily basis. So vitamin C can help with metabolism, which is how you absorb your foods. It can help with your iron absorption. It can help the way you work with your amino acids. That's the breakdown of your proteins. So vitamin C helps in those different ways, and I recommend a person takes 1,000 of vitamin C twice a day.
Did you say as you get older you need more of vitamin C?
Not necessarily. I mean, your body may become deficient if you're not eating well over many years, but not necessarily need more vitamin C as you get older. But vitamin C is a great antioxidant. Whenever a person's coming down with a cold, I usually recommend that they take some excess amount of vitamin C and maybe add some echinacea, things like that, extra fluid. So vitamin C can be very helpful. But vitamin C, the recommended daily allowance for vitamin C is only 60 milligrams. But I recommend 1,000 milligrams twice a day. The recommended daily allowance is the amount that they found that would prevent us from getting a disease that we know of that's caused by a vitamin deficiency. That's how they came up with those. And the people that come up with those were young, healthy, usually white males. And so that doesn't really describe the average person in society. And so you have to take the recommended daily allowance of things for. You got to take it for what it's worth. It's a guide, but by no means is it the the almighty. Is by no means is it. You shouldn't look at anything else because you really should.
It's not extra stuff. Okay.
Right. Okay. Next one, vitamin D. A lot of people heard of vitamin D, and the D is part. People hear bone matrix. Vitamin D is part of the making of strong bones, and there's several different forms of D that you can get on the market. D3 is the one I usually recommend. A lot of people are deficient in D. You get vitamin D from from the sunlight. So if you're spending enough time in the sun, you may be good on your vitamin D. A lot of African Americans don't spend a lot of time in the sun, and when they do, they're very much clothed, and so they may not have enough vitamin D. A lot of times when I test my seniors, they're often deficient in vitamin D. Now, when you're deficient in vitamin D, it also can help with memory. It also can help with balance. So for those of you who may be deficient, maybe you have challenge with balance, maybe you have challenge with memory, it's just one of the many things that could contribute to that. But have your healthcare provider check your vitamin D level. It's simple enough to correct. I usually correct it with 100,000 units of vitamin D once a month for 3 months, and then I start giving it on a daily basis, maybe 1,000 a day or maybe 5,000 a week. It's no exactness to that science, but their goal is to get your stores up into the normal range. And what does it take to do that? Usually something about the way I just described. Vitamin D, when you're talking about being strong and helping with the bones, magnesium is a very important component to have magnesium associated with your vitamin D to help it. Your bone matrix. Your bones are constantly making and breaking down your entire life. You have osteoclasts that break down bone and osteoblasts that build up bone. And our goal is that they're working in harmony, that they're breaking down and building up in harmony at the same time. When the osteoclast starts winning, then you may come up with a disease we call osteoporosis. You've eaten more bone away than you've made bone back. And that's a challenge that we get in lots of people as they get older, and they're more likely to break a bone if they fall or something like that. So osteoporosis can be treated, and there's medication treatment, but the medication treatment I generally recommend is going to be the Forteo injections, but then you also need to supplement with the calcium, the magnesium, the vitamin D. The vitamin E, another very common vitamin people hear about. And again, vitamin D and E, those are fat-soluble vitamins. The B's and the C's are water-soluble vitamins. When you talk about vitamin E, again, a great antioxidant. It's been referred to as slowing the aging process, helps protect the red blood cells, helps prevent in the blood clots. There's studies that suggest that if they help with the heart, may help with the memory, may help with the cardiovascular system. This is where I mentioned that example earlier. You have natural vitamin E and you have synthetic vitamin E. The natural vitamin E is going to be much more potent than the synthetic. It's usually going to cost more as well. It's hard to know what you're getting when you're getting your vitamins. So, do some research, check out the companies, make sure they're a reputable company, make sure they've been around a few years. Many times your health food stores as well as your multi-level marketing companies, many times they're going to have some of your better vitamins because they've had the money to put into some research and development and to develop to come up with some better ingredients. So that's often a good place to look for your vitamins and minerals. Potassium, many people hear about potassium. Now potassium, many times we give a person potassium in the form of potassium chloride, KCl, when they're on a fluid pill, they're on Lasix, they're on HCTZ, things like that. We'll give them potassium, which is usually going to be a higher dose than what you'll get in a supplement. So when you talk about the supplements, potassium, there are the ones you can get over the counter, but you want to be careful with that. Again, it's a fat-soluble vitamin, so you could take excess, but other good sources of calcium potassium would be orange juice, vitamin C, the skin on the potato, green leafy vegetables. Those are other good sources of potassium. And potassium
on the potato, you say?
The skin on the potato, it's a good source of potassium. Most people don't eat the skin.
True.
Most people throw that part away, but it is a good source of potassium. But potassium is going to help in the blood clotting, the liver functions. If your potassium is not functioning well, a lot of times a person may have some bleeding problems. So there's many reasons to have a bleeding problems. Potassium would be one of them. But there are many more problems, and potassium is usually not first on the list. But it could contribute to that process. Let's see, what will be next? Another zinc. Zinc is, now we're talking about a mineral. And zinc is one of your minerals. I usually recommend 220 milligrams of zinc a day when you've got a wound and you're trying to heal a wound. The recommended daily allowance is 15 milligrams a day. So it's a varying amount of how much zinc one would recommend. I usually minimally recommend 60 milligrams a day just for general health. Zinc can help if you're diabetic. It can help with your insulin making it into your cells. Zinc can help with your blood vessels. It can help with sugar control. Zinc is needed for your helping your taste bud, helping your hearing. And again, can improve wound healing, and it's also important in enzymatic reactions. Enzymes make a reaction go faster. It's like a catalyst makes a reaction go faster. Enzymes also help break down things, and zinc is like a cofactor there. It's like your co-pilot. Zinc doesn't do that by itself, but it helps in that process. So zinc's a very important one there. Selenium's another one of your minerals. Selenium can another strong antioxidant, can be very helpful with protein utilization in your body. It also mixed with vitamin E can be a very helpful thing in helping you utilize protein. Now we talked about vitamin K, and the next way of talking about vitamin K would be potassium.
Okay.
So potassium would be what I would give you in a prescription form, and vitamin K would be what you could get in a multivitamin. Now potassium, it helps with one of your electrolytes. When we talk about electrolytes, that's the fluid inside your blood. That's the fluid that's bathing each one of your cells, and potassium is one of those main electrolytes. And when your potassium is abnormal or out of balance for some reason, say it's too low or too high, you could get some abnormalities with your heart not beating correctly. You have some challenges with your blood vessels, have some challenges with blood pressure. So potassium is one of those very important electrolytes that helps your body stay in balance. And primarily with your heart and your nervous system is where it's probably going to show up as one of the most important factors there in those two systems. And when you talk about potassium, you talk about the heart and nervous system, another mineral very important in your nervous system is going to be magnesium. Another very important mineral. The recommended daily allowance of magnesium is 400 milligrams a day. So that could vary in how much you take. A lot of times you might find a vitamin D on the market that you're going to take along with some calcium, and it might have some magnesium. So vitamin D, calcium, and magnesium, that might be a good supplement in helping with your bones. But vitamin magnesium, also very helpful with your heart, very helpful with your nervous system, your teeth, your bones. When a person's pregnant, magnesium is important for building that new baby structure as the nervous system is being built, as the heart's being built. So another very important mineral. Iron, people hear about being anemic, so that's where the iron comes in. Iron is another one of your minerals, and your iron helps bind to oxygen and carry oxygen to the different tissues. If you don't have enough oxygen going to the tissues, then your body's not going to be happy. Your body's going to be pretty disappointed when that happens because you're not going to be able to carry the right amount of oxygen to the different tissues in your body. Again, those of you who want to know more about these things, there's plenty of places you can look on the internet and dig in and learn more about these things. You can always go by my website, which is AskDrFerguson.com. I have a lot of natural things on the website, a lot of preventive healthcare products that you can partake of. On the link page, you have places you can go and find out some other preventive healthcare things you can do. My goal is to give you some fundamental knowledge on preventive healthcare things that you can use immediately. Calcium, we've talked about calcium off and on, but Bone Mate is one of the calciums that I have on my website is calcium citrate malate. The malate is one of your more absorbable forms of calcium, which is a great form of calcium. So if you're on my website, Bone Mate would be the calcium there. It helps build strong bones and teeth. It's involved in your nervous system, muscle contractures. If your calcium's low or high, you may have some challenges with nervous system, muscle contractures, heart. So calcium, everybody's heard about calcium, and it is a very important component in helping your body have the building blocks to keep strong bones and teeth and nervous system. So you can see that when we talk about vitamins and minerals, they all go hand in hand in helping our body to function the way in which we want it to function at its best. And even if you're eating the very, very best, you're still probably going to be deficient in some of these things. Why? Because where do the vitamins and minerals come from? It comes from the soil. Well, what comes from the soil? The plants and the vegetables. Well, if the plants and vegetables are grown in the soil and the soil is deficient in one or more of the vitamins and minerals, well, how are you going to get it into your system? You're not.
Right.
And so this is why it's so important that you have supplementation as part of your daily regimen. This is one of those topics in medicine that goes up and down like a roller coaster. Some people will say it's important, some people will say it's not important, some will say it's important, and some will say it's not important, and you'll go back and forth. There are a few good studies out there that show that vitamins and minerals are very important, particularly for a person who has chronic diseases like hypertension or diabetes or something like that. But I would suggest to you that the vitamins and minerals are very safe in general. And wouldn't you like to know that you did something in the preventive healthcare realm 20 years earlier, 30 years earlier? Then we do some great research, and then we find out, well, you should have been doing this 20 years ago. So preventive health is the key, and I would suggest to you that we use the Bible as their guide for what we should use in preventive health, and the types of foods and the types of things the Bible talks about are the things I think we need to make part of our diet. And the Mediterranean diet, just as a quick side note, I think is probably one of the best outlines of a diet to eat. And you can go to my website, look under frequently asked questions, and you'll see an outline of the Mediterranean diet. Well, the Mediterranean diet is high in antioxidants, it's low in red meat, it's low in saturated fats, high in vegetables and fruit, high in water. So these are the kind of things that we're always talking about. You want to take the types of foods that are good, be great antioxidants, that are going to be cancer-fighting foods. If you say a cancer-fighting food, that's going to be a food that's probably a great antioxidant. And so these are things that you want to build upon. Nobody's going to know all these things on the first day, but you build upon the information. You listen to people that you trust what they're saying and what they're doing, and you build upon that. And again, those of you who'd like to reach me, you can always call my office at 252-332-6484. You can go by the website, askdrferguson.com. And you can also visit me on multiple other places on the internet. If you just type in my name, Stephen Ferguson, or Ask Dr. Ferguson in the internet browser, you'll find lots of other things I have on the internet.
And thank you so much. We got as far as with the iron, so next week should I be with you in the morning, I would know where to start, and maybe we finish.
Right, and just before we end, I just want to make sure people listen to the Talk Back Now with Patricia. It comes on 11 to 12. She talks about she talks about politics and how that's affecting our lives, and I think her listening audience has actually surpassed my listening audience. So tell your friends about it, and don't forget to join them. On that note, be blessed. Have a wonderful day, both our local and our international audience.
Thank you so much.
Bye-bye.